Western Mass News is getting answers on the rise in attention deficit and hyperactivity cases and how has triggered a ripple effect causing medication shortages. Western Mass News reporter Libby James spoke with a Bay State doctor about what they're seeing here in Western Mass.
It's been kind of a snowball effect with a lot of patients now having trouble accessing medications. Now, I treat mostly kids and some young adults. But it's been an issue all throughout Western Massachusetts.
Western Mass News spoke to Dr. Bruce Wasik, the chief of child psychiatry at Bay State Medical Center, about the rise of ADHD cases during the COVID-19 pandemic and the shortage of medicine that has followed. ADHD stands for Attention Deficit Hyperactivity Disorder, which has a range of symptoms, but according to the American Psychiatric Association, symptoms include inattention, hyperactivity, and impulsiveness. The latest data from the Centers for Disease Control and Prevention is from 2016 to 2019, when about 2% of 3 to 5-year-olds were diagnosed with ADHD, 10% of 6 to 11-year-olds, and about 13% of 12 to 17-year-olds. However, Dr. Wasik says since the pandemic, those numbers have increased, especially with children experiencing trouble with remote learning.
We had a number of consultations for kids who were struggling in school, who had never struggled before, but they were struggling through the online learning.
He tells us this has resulted in an increased need for ADHD medication.
And we've been aware of a shortage of Adderall since the fall of 2022. It's persisted and continued through 2023 and still an issue today. And it seems to also have triggered a secondary issue is because people can't get Adderall. A lot of doctors are switching their patients to other medications that treat ADHD, and we've seen shortages in the other medications as well.
Dr. Wasik advises those thinking of taking ADHD medicine to consult with a doctor first.
The medications that we're talking about are controlled substances, so there are potential benefits to the medications, but also substantial risks. So the best way to go about determining if somebody is suffering from ADHD is to get a full evaluation.
Reporting for Western Mass News, I'm Libby James.
Western Mass News contacted Teva Pharmaceuticals to comment on the shortage of their ADHD medication Adderall. However, we haven't yet heard back.